Hello and welcome. Let's discuss about UTI drugs with their chemical structures, IUPAC names, uses, and side effects. Moreover, we will discuss the SAR of quinolones and synthesis of a few drugs. Now, let's discuss about classification of drugs used in the treatment of UTI. We have divided the drugs into two classes. One is quinolones and the second one is miscellaneous. Here in quinolones group, naldixic acid is non-fluorinated compound because in naldixic acid, fluorine is not present in their structure, unlike others. The drugs those have fluorine in their structure are known as fluoroquinolones, like norfloxacin, anoxacin, ciprofloxacin, ofloxacin, lumifloxacin, getifloxacin, sparefloxacin, and moxifloxacin. In the miscellaneous one, we have the three main compounds like furazolidine, nitrofurantoin, and methenamine. Naldixic acid. Naldixic acid is a non-fluorinated class of quinolones antibiotic. This is a broad spectrum antibiotic. Now let's see the structure chemistry. In the first position, ethyl group is present. In the third position, carboxyl group is present. In the fourth position, ketone group is attached. Now come to the second ring. In the seventh position, there is a methyl group attached in the ring system, but there is no fluorine atom is present in the sixth position. That's why it's called non-fluorinated class of quinolones. But in the eighth position, nitrogen atom is present. That's why this ring system is known as naphthyridine ring system. Now let's come to the mechanism of action. It inhibits the replication of bacteria by interfering with the action of DNA gyrase during bacterial growth and development. Adverse drug reaction includes nausea, vomiting, and diarrhea. Allergies are rash, urticaria, fever, photosensitivity. CNS adverse drug reactions are headache, malaise, drowsiness, and myalgia. Doses regimen 0.5 to 1 gram of daily once or divided doses are given for 10 to 14 days. Ciprofloxacin. Ciprofloxacin. This is a second generation class of fluoroquinolones derivative. This is used to treat gram-positive bacteria. Dosage regimen for ciprofloxacin are 500 mg twice a day for 7 to 14 days for normal adults. Side effects include feeling nausea and vomiting, diarrhea, redness or discomfort in the eyes, bad taste in the mouth, etc. Now see the structure. In the first position, cyclopropyl ring is present, and the sixth position, fluorine atom is present. In the seventh position, piperazine ring is present. But in the eighth position, no nitrogen atom is present like naldixic acid. So this ring system is known as quinonine ring system. Norfloxacin. In the norfloxacin, this is a second generation class of fluoroquinolones derivative. This is used to treat gram-positive bacteria for UTI. In the structure, it is similar to ciprofloxacin, but in the first position, ethyl group is present, and remaining everything is similar to ciprofloxacin. As usual, in the seventh position, piperazine ring is present. Sixth position, fluorine ring is present, and this ring system is known as quinolone ring system. Dosage regimen 400 mg every 12 hours for complicated urinary tract infection 10 to 21 days, uncomplicated UTI, cystitis due to E. coli, Calcibacilli, and Proteus 3 days, and complicated UTI due to other listed organisms 7 to 10 days. Side effects include allergic reaction, includes hive, skin rash, fast heartbeat, difficult in breathing, swelling face, lips, tongue, and throat. Anoxacin. This is second generation class of fluoroquinolone derivative. Adverse effect: anoxacin triggers seizure or lower the seizure threshold. should not given the epilepsy ill patient. Interaction include ranitidine, sucralfate, antacid containing magnesium or aluminum. Co-administration with this substance can lead to therapeutic effectiveness of enoxacin due to less absorption in the intestinal tract. Now let's see the structure. In the first position, ethyl group is present, and in the sixth position, fluorine atom is present. In the seventh position, piperazine ring is present. But in the eighth position, nitrogen atom is present, like naldixic acid. So this ring system is known as naphthyridine ring system. So in naldixic acid and enoxacin, the ring system is same. But in naldixic acid, fluorine atom is absent. But here in enoxacin, fluorine atom is present. Bayer's process of ciprofloxacin synthesis. Here, 2,4,5-trifluorobenzoyl chloride reacts with ammonoacrylate in the presence of chloroform and PEA undergone condensation reaction and form an intermediate compound. This intermediate compound reacts with cyclopropylamine and form an intermediate followed by reaction with K2CO3 and DMF undergo cyclization and condensation with piperazine and form ciprofloxacin. Ofloxacin. This is second generation class of fluoroquinolones. This is effective against both gram-positive and gram-negative bacteria. Doses regimen for complicated cystitis due to E. coli or K. pneumoniae are 200 mg twice a day for 3 days. Complicated UTI 200 mg twice a day for 10 days. Prostatitis due to E. coli 300 mg twice a day for 6 weeks. Side effects including tendon problem, permanent nerve damage, serious mood or behavior changes, or low blood sugar. Now let's see the structure. In the ofloxacin structure, similar like ciprofloxacin, but in the 1 and 8th position, one ring is present with nitrogen and oxygen in the para position. This ring system having double bond in the second position and third position. This ring system is known as oxygen ring system. So with oxygen ring system, quinoline ring system is present. That's why this ring system is known as oxygenoquinoline ring system. Ciprofloxacin. This is second generation class of fluoroquinolones. This is effective in gram-positive bacteria. Doses regimen for complicated UTI 400 mg orally once daily for 14 days. Side effects include allergic reaction, seizures, confusion, hallucination, liver damage, and muscle or joint pains are seen common. Now let's see the structure. It is similar to ciprofloxacin, but in the first position there is a ethyl group is present. In the sixth and eighth position, fluorine atom is present. Difluorine atom is present. In the seventh position, piperazine ring is present with methyl group in the meta position. Getifloxacin. This is a third generation class of fluoroquinolones derivative. It is effective in gram-positive bacteria, particularly in pneumococci. Doses regimen: getifloxacin 400 mg as a single dose or 200 mg once daily for 3 days with complicated UTI. For complicated or pyelonephritis, 400 mg orally once daily for 7 to 10 days. Side effects: discharge from eyes, eye irritation, eye pain, eye swelling, dry eyes, and diarrhea, etc. are seen common. Now let's discuss about the structure. Structure is again similar to ciprofloxacin in the first position itself. First position cyclopropyl ring is present similar to ciprofloxacin, but here one difference is in 8th position methoxy group is present. Remaining everything is similar to ciprofloxacin. Sparefloxacin. This is a third generation class of fluoroquinolones derivative. Now let's discuss about the structure. Similar to ciprofloxacin. In the first position, cyclopropyl ring is present. In the sixth and in the eighth position, dimethyl group is present along with in amino group in the fifth position. And in the seventh position, piperazine ring is present with dimethyl group in the levorotatory position. It is effective in gram-positive bacteria, particularly in pneumococci. It is a significant potential to further improve the effectiveness of treatment, patient convenience, and patient compliance with short course of therapy for uncomplicated UTI. This is a fourth generation class of fluoroquinolones derivative. But this is not used in the treatment of UTI infection because it doesn't achieve any adequate concentration in the urine. It has increased activity against pneumococci. Now let's discuss about the structure. In the prime first position, cyclopropyl ring is present. In the sixth position, fluorine atom is present. In the seventh position, heterocyclic ring is present. In the second and eighth position, dinitrogen ring is present. This is pyridine and this is pyridine attached with pyrrole ring system. Mechanism of action includes it reduced by bacterial flavonoids into reactive intermediates that damage bacterial DNA, RNA, and other macromolecules. Indication UTI and prophylaxis of UTI. Dosing of nitrofurantoin 50 to 100 mg orally 4 times daily for 7 days. Prophylaxis of UTI similar 50 to 100 mg daily in bed times. Side effects are common side effects nausea, vomiting, flatulence, color change of urine, serious lung disease, liver problem, numbness, and tingling sensation. Nitrofurantoin are nitrofuran derivative. This is the first heterocyclic compound to be introduced into chemotherapy of urinary tract infection. This is effective in 5-nitro-2-furaldehyde. Now let's discuss about synthesis of nitrofurantoin. Nitrofurantoin synthesis includes hydrogen reacts with fluoroacetic acid. They form hydrogenoacetic acid. Hydrogenoacetic acid reacts with KNCO in the presence of hydrochloric acid and then form semi-carbaxidoacetic acid. Semi-carbaxidoacetic acid undergone cyclization reaction and form 1-aminohydrantoin. 1-aminohydrantoin reacts with 5-nitroperfural and then formed as an end product of nitrofurantoin. This is a class of nitrofurans derivative. Mechanism of action: furazolidone and its related free radical products are believed to bind DNA and induce cross-links. Bacterial DNA is particularly susceptible to this drug, leading to high level of mutation in the bacterial chromosome. Dose: adult 100 mg 4 times daily for 5 to 7 days. Children above 1 month of age 1.25 mg per kg 4 times for 5 to 7 days. Side effects include fever, itching, joint pain, skin rash, and redness or sore throat. Methenamine, other names hexamethylene tetramine and eutropine. Mechanism of action: it doesn't show any bacterial effect in the alkaline environment more than pH 6. However, in more acidic environment less than pH 6 is hydrolyzed to formaldehyde and it is highly bactericidal. Formaldehyde has non-specific bacterial activity and work by denaturing proteins and nucleic acid of bacteria. Certain bacteria such as Proteus species can alkalize urine, inhibiting the beneficial activity of formaldehyde. Indication for prophylactic or suppressive treatment of frequently recurring urinary tract infection when long-term therapy is considered necessary. This drug is not used to treat infection and should only be used after appropriate eradication of infection with antimicrobial agents. Now we will discuss about structure activity relationship of quinolones. In the first position, alkyl group is essential for activity. Now, if the alkyl group is smaller, the potency is increased, but the cyclopropyl has the highest potency among methyl and ethyl group. Seen in the ciprofloxacin having cyclopropyl ring system in the first position, or norfloxacin having ethyl group present in the first position. Hence, cyclopropyl has the highest potency, so ciprofloxacin has the highest potency than norfloxacin. Second position, substitution in the second position reduce the activity of the molecules. Saturation of the double bond between second and third position leads to loss of activity. So double bond in the second position and third position is required. Position third and fourth. In the third position, carboxylic acid is essential for the activity. Other acids are decreasing the activity. In the fourth position, ketone group is essential for the activity. In the third and fourth position, carboxylic acid and ketone is essential for binding to DNA gyrase. Having carboxylic acid and ketone group in third and fourth position respectively maintain polarity of the compound, which is essential for binding. This third and fourth position is responsible for chelation of divalent and trivalent cation like magnesium, calcium, zinc, and iron, which form insoluble compounds, leads to decrease the viability. Hence, given with antacid, milk, and iron decreases the absorption of quinolones drugs. Fifth position. In the fifth position, small groups like NH2, OH, CH3 it increases the activity. Example, ciprofloxacin having ammonia in the fifth position. Sixth position, fluorine in the sixth position increases the lipophilicity of the drug. All the drug having fluorine in their sixth position except naldixic acid. See the diagram. Naldixic acid doesn't have fluorine in the sixth position. Seventh position. Compared with other group, piperazine ring increases the activity, which extended the gram-negativity activity of quinolones. Example, ciprofloxacin, norfloxacin having piperazine ring attached. In the seventh position, having paramethyl group further increases the activity. Example, ofloxacin. Paramethyl group is present in the piperazine ring system. In eighth position, if fluorine group is attached, in the eighth position increases the activity toward atypical organisms. Ring fusion. If the ring fusion occurs at 1, 8, 5, 6 or 7, 8 position increases the activity. In ofloxacin 1 and 8 position, oxygen ring is fused, so it becomes stereocenter, which makes ofloxacin dextro and levoisomer. Here, levoisomer is more active than dextroisomer in case of ofloxacin. Thank you.